do I relate to that as an instructor, but as a mom, I relate to that too, because 7 years ago, I went through nursing school again with my daughter, so I get it, how stressful that is. All right, so, hello, welcome back. So, ladies, let's listen up. You good? You good, Becky? Ready? Good? So, because it's such a stressful day, I want to throw something at you, see if you think this is a good idea. How about we do an hour of some stuff, some math stuff. For lab, you go home, you do your lab at home. I post the answers on Blackboard. Next week, if you have any questions, we go over it. Sound good? Alrighty? I think you guys need that. Because I'm looking at it, I don't even know I'm getting an hour out of you right now. The 30th, October 30th. October 30th, yeah. It's like in like a little less, like a day less than, it's 20 days.
Can we breathe?
Yeah, for 20 days. Alright, so, today we're gonna go over just a couple of things. We're gonna like, do some real simple things, because I know you, in the beginning, we'll do some real simple things, because I know your brain needs a little bit of a reprieve. We're gonna introduce some things that may take some brain power, but we'll be all right, okay? So today we're gonna be talking about oral medications. Now, so we know, we talked about this way back when we met 3 weeks ago, that oral medications come in PO form, tablet form or liquid form, okay? So it's either a pill, which is tablet, capsule, it's a pill, or a liquid. What's that? Can't do it? You can do it.
Try.
Please help.
Yeah, my brain is like.
Oh, I get it. I do get it. But listen, if you don't get what we do today, there's always tutoring to go back on Monday, next Monday. She has all of I gave her all the practice questions that we do in class, and then she makes up practice questions exactly the same. So if you really can't get it today, don't worry, we'll get it, all right? I get it today was a hard day. That's why I'm trying to, I'll be as entertaining as possible. All right, so this is going to be super easy. You don't even have to do dimensional analysis to think about this one, but let's just do it anyway just because we want to have fun, right? All right, this is a one-step conversion. So as you can probably know, we're going to go on to two-step conversion soon. The question is, if the doctor orders 50 milligrams of Atarax, how many tablets of that? Well, we know from here, what are your tablets? So you read this, how many milligrams is each tablet? 25, right? It says 25 milligrams. So we know that one tablet is 25 milligrams. Simple, just cross it out. You don't need to do any other kind of conversion. 2 tablets. You with me? Mm-hmm. Viaxin, 0.5 tablets. Well, how many milligrams, how many is this?
250 milligrams.
Uh-oh, this is in grams. This is in milligrams. You know you gotta do your conversion. So here's your order, 0.5 grams. Each tablet contains 250 milligrams. We can't cancel these out, so we have to do 1,000 milligrams, 1 gram. Get it all out. 2 tablets. This is a PowerPoint. These are not trick questions. This is PowerPoint on your Blackboard. Not that I give you any trick questions. You know what I mean. Cataflam, 0.1 grams. What's the dosage here for each tablet? 50 milligrams. All right. So same thing. You have to convert. So 1,000 milligrams, 1 gram, 2 tablets. With me so far? I'm not asking for too many brain cells? No. All right. 100 milligrams equals how many mLs? Well, you tell me. 250 and 5 mLs, right? So that told me what it was. So go back to the doctor's order. I know that mLs have to go up here because I know I need mLs in my answer. So 5 mLs, 250, cancel those 2 out, answer comes out to 8. So that mLs we know it's in liquid form. It's not a tablet. I'm pretty sure I said this to you 3 weeks ago. We know that a 30-pound child is not going to get the same dosage of a medication as a 300-pound adult, right? So we know that we have to do weight. We have to calculate some medications by weight. So let's take a look at this one. The prescriber orders 20 milligrams per kilogram of a medication for a client that weighs 75 kilograms. Well, that was nice of them. They gave us the weight in kilograms, but no conversion here, right? How much of this medication should the client receive? Well, we know that, see, I would have done this a little differently. I would have put here, so it says how much is medication? Well, it's milligrams. It's not too clear for you, but it should be milligrams. All right, so doctor ordered 20 milligrams per kilogram, right? Then I would have looked at, okay, child weighs 75 kilograms. Cancel it, 20 times 75 is 1,500 milligrams that this child is getting.
This was 75 pounds right there.
75 kilograms.
Well, you wrote
I made a mistake, I wrote that. I was hoping nobody would notice. You're sharper than I thought you'd be at this time on exam day. All right. Oh, listen, these are yours on Blackboard. I just pulled it off of Blackboard, so you don't have to even worry. This is here. This is under Unit 3. Okay, this is Chapter 6, Unit 3 on Blackboard. Next, have you heard of the medication potassium yet in nursing 18? Yeah, maybe something, you don't remember, you don't know your name right now. All right, so potassium comes in milliequivalents. This is just the way it comes. It's milliequivalents. There's no conversion to milliequivalents. Don't worry, it's like not 1,000 milligrams in 1 milliequivalent or anything like that. Milliequivalents are just milliequivalents. So we call them meeks in the hospital because it takes a long time to say milliequivalents. Too long. We don't have that kind of time. We call them meeks. All right, so a label reads K-Lor, which is potassium. That's liquid potassium, 20 meeks. This packet provides potassium 20 meeks in 4 ounces of cold water. So in the nursing home, you might be giving this to your patient. So a lot of you, if your patient has a low potassium level, they found on blood work, they're going to tell you, okay, you need to give this patient some potassium. This is a liquid form of potassium. This also comes in IV piggyback form. Never, ever, 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 ever give potassium IV push. You know why? Patient dies. Yep, cardiac arrest, done, dead, okay? So it's either PO or it's IV piggyback. Remember the difference between, we did this day 1. This is IV piggyback. This is IV push. If you misread, you think that this says IV piggyback and this is IV push, or I'm sorry, if you read this as IV push and you give this patient potassium IV push, they're dead. So I cannot stress that enough. Make sure you do not make a mistake on that. Okay, so what this is this is telling you if you add 4 ounces of water to this, it comes in a powder form. You can't have your patient sucking down powder, okay? You have to put it in a liquid form. Add 4 ounces of water, this is what this patient will have. So doctor orders, where's the doctor's order? Where do we get the 30? Right here in front of me. Doctor orders 30 meeks PO daily. So doctor orders 30 meeks. We know that there's 4 ounces, 20 meeks in 4 ounces. Patient's getting 6 ounces of this total. Okay? What?
Can you just read it?
Yeah, sure. Doctor orders 30 meeks, right? Well, let's put it over here. So they're asking you, the question is how many ounces is the patient getting? We know, it tells you there, that in 4 ounces there's 20 meeks.
Oh, okay.
But the doctor's ordered 30. Okay? So 30 meeks, 4 ounces, I know that goes on top because I need that, in 20 meeks. Cancel that out, 30 times 4 divided by 20. Okay? Alright, so I said this to you also on day 1. Remember, the scored tablets only can be cut in half. Only. Never try to guesstimate. If it's not scored, you cannot cut it. Read the questions carefully. Ask yourself, what is the question asking you? Is it per day? Is it per dose? And then go ahead. Alright. So now we're going to do, this is next week, syringes. Now we're going to do some on our own. I'm starting off simple, alright? We're going to get a little bit more fun. But please do not call out the answers because some of them that are so simple that you're going to, duh, you know, 1 or 2, or whatever, 3, whatever. Don't call it out. I want you to get used to the exponential analysis, all right? All right. Doctor's order is a tenolol. You know what that is? It's a beta blocker. If it ends in LOL, that means it's a beta blocker. I'm trying to block my Staten Island accent right now. BETA blocker. BLOCKER. That's used for, anybody know? Hypertension. Okay, so 50 milligrams. Oh, so if it ends in LOL, it's a beta blocker. Hey, sweetheart.
I
Hello.
just want to pick up my bottle of water, but
Yeah, sure. What is it?
sorry.
Oh, your water. I thought you said your brother. I'm like, where? Bye, sweetheart.
Thank you.
Okay, 50 milligrams. QD. Tablets on hand is 50 milligram tablets. Don't pull out the answer. Just tell me how many tabs you're gonna give.
QD per day, right?
Per day, yes. It's so easy, it could be hard. And that's no tricks.
No.
Correct. Okay, so it's 50 milligrams. Each tab is 50 milligrams. All right, easy, easy. 50 divided by 50 is 1. All right, a nurse is to administer amoxicillin. What's that?
Antibiotic.
Antibiotic, right. If you're allergic to penicillin, you're also allergic to amoxicillin, so you gotta be careful.
It's antibiotic.
Yes, exactly, very good. 500 milligrams. BID. On hand are scored tablets labeled on hand. You have 250 milligram tablets. How many tabs per day? 4. Don't pull it out. I told you, it's gonna be, some of them gonna be super easy, but let everybody just walk it, walk through, dust off some of the cobwebs. Some of you might have thrown all of your nursing 17 information away while you were studying for set 18. I get it. All right. All right, what do we come up with? 4. Okay, so we got 500 milligrams. Each tab is 250 milligrams. 500 divided by 250 is 2, but it's asking per day. How many times is BID?
Bad.
Twice. So that's 4 tabs a day. All right?
So it's, no, you're not asking for dose, we have to find by day, right?
I asked per day, yeah. But if I ask per dose, the answer would be 2.
2.
Right. All right. So this one is potassium chloride, 20 weeks daily. On hand is, this is potassium, 10 make tabs. Please don't call it out. How many tabs?
Wiring infection or the prevention of and also assess for the
Hygiene.
hygiene.
Pressure injuries, right.
It's hygiene.
Remember, believe it or not, I mean, we know
It makes them
this-
feel good also.
Yeah, but we know that how important scientifically, evidence-based, why it's important to be bathed on a daily basis, right? So our skin stays intact, wash away bacteria, blah, blah, blah. Back in the day, okay, when Florence
Right,
started
yeah.
everything, there was literally no
do,
such
right,
thing as
okay,
infection control. People
Got
would did not bathe, people did not change their clothes, even when they were healthy.
That,
Okay, there was
20
very
divided by
little
10.
sanitation, whether it was sanitation for the food or
It's not all these
sanitation for personal.
Doctor orders.
Probably many people got very young. That is, honestly speaking, infection.
0.5 milligrams.
So we bathe our patients,
times a day.
provide hygienic care for a multitude of reasons. Besides
Xanax. Could you all use that this morning? All right, on hand is a bottle that contains 1 milligram per ml. Tell me how many milliliters per dose?
Hygienic care and use that time to focus on our patient, because what? We're doing a skin assessment. We're seeing their skin, okay? So we'll see things that maybe other people didn't see before. So don't be so quick to turf that off to a CNA, because you might see an old scar, you might see something starting to fester, and maybe the CNA is not knowledgeable enough to bring it to your attention, okay? So we do skin inspection, we do skin assessment, we can listen to the posterior side of the patient's lungs. And what else can we do? We can teach our patient, right? Any interaction that we have with them, even something like bathing, we use it as an opportunity to teach and to assess.
So what do we get?
And to reteach. So say for
0.5,
example, the patient
right.
is partial.
0.5
What do I mean by
milligrams.
partial?
Each ml is 1 milligram. So 0.5 divided by 1 is 0.5.
Partial.
What if I told you
can
how much
partially,
per day?
They can do something, right? They can do
0.5,
something.
correct. It's 3 times a day.
So
0.5
what if
times
I'm
1.5.
totally important?
So times 3 is 1.5. With me so far? All right, ready to have some fun? Shake it up a little? All right, let's shake it up.
One arm to the other.
All righty. Now that was all one simple one-step problem. Let's go
So I'm
to
gonna set 'em
multi-step
up.
problems.
I'm gonna get
All right, we have the doctor orders for this patient 5 milligrams per kilogram per day.
Is he
The
doing?
patient weighs 100 pounds.
Is he doing it?
Tell
sufficient?
me how many
Does he need
milligrams
encouragement? Now,
are
if
you
he's
gonna
doing a
give
great
this
job,
patient?
of course I'm gonna tell him, you're doing an amazing job. That always pumps people up, everybody likes to.
Now, we haven't done one like this yet, so let's just do this
And
one
then I
together.
can use the time to
Milligrams.
educate.
All right, so 5
All right,
milligrams
so
per kilogram goes like this.
Even though you're doing
5
something,
milligrams
you can
per
always think
kilogram.
about.
Remember I told you eventually there'd be
switching
something at the
else
bottom?
in. Okay, that would.
All right, so what do I do?
Then
I
when
need milligrams,
the patient
but I gotta get rid of
has had
kilograms.
sufficient time to do
What do you think I
what he
should
needs
put
to do,
here?
Then you might help him. with
Yeah,
the
I'm gonna put
rest.
1 kilogram is
So say if
2.2
you're
pounds,
washing his
right?
arm,
I get rid of the kilograms, but uh-oh, stuck
or
with
both
pounds.
arms, you would start where?
100.
Pounds. How do I know that? You said the patient weighs 100
And then
pounds.
work your way.
Cross it out, cross it out. 5 times 100 is 500 divided by 2.2.
Strokes, bringing it
And that
up
comes
to the
out
body.
to
Why am I doing it? I'm not scrubbing a frying.
227.
Not doing this. Can you put that under stimulate?
Yep, it doesn't matter
Circulation.
where you put this.
Yeah, like,
If you want to put it here,
Yeah.
For the same
put it there.
reason,
It's not gonna change your answer. And then you would just put the 1
Wash
kilogram,
your
2.2
patient.
pounds.
No, I'm asking you if
Ted
it's better.
stockings or
No.
Ted stockings on.
No, whatever works for you.
Okay.
As long as what's on top and what's on bottom is in the correct place, it doesn't matter the order you put it.
Wash
Whatever works
them,
for
you
you.
dry them, no powder.
It works for me to start at the back, go back to the doctor's order. That's what works for me. And then get rid of everything else. But if it works for you that way, do it.
No, I think it's better the way you did it before, because
To keep
if
that
I put it at the beginning, I wouldn't know which one to put first.
Right,
top or bottom.
exactly,
Yeah.
exactly.
Here with
My,
the
my,
with your patient
what
is
I need
able
to tell you is a lot of you will try to do this in problems,
If they
especially
get out of
coming
bed
up
and
in
sit
a
in
few
the chair,
minutes.
then
Do not try to
clean the bed.
convert 100 pounds into kilograms outside of the problem. In other words, don't, I don't even know what this is gonna be, let's just say it's gonna, you know, I don't know, we'll make it 50
What
kilograms just to
about
make it easier,
pericare?
right?
Or
Do not
boring care?
put 50 kilograms in here. Don't convert it outside, convert it in here, because what's gonna happen, if it's a whole number, it's no big deal.
You can't
But what's
ignore
gonna
it.
happen is, when you say, start to have to round to the nearest
Yeah.
10, that's when it's gonna become a problem.
Yeah.
Because if you do this outside of the problem, and let's say you get 49.2179, right? and you don't, and you just don't, convert it to the right number,
So I
this
make
is
sure
gonna be
I
wrong
have
with
lots of washcloths.
So just get used to converting it here in the problem.
Gently,
With me?
okay, always gently.
All right.
I'm not afraid to
Alright, that's what I'm
test.
being, I'm being as entertaining as I can. Somebody tell a joke. A nursing student came to school one day.
Doesn't matter.
We just had a new demo.
That joke's over, that's a joke.
Anyway, the idea is,
Alright,
now in this
so,
picture, it's
we have a
lovely,
patient that's gonna
they
get,
have the basin,
one
they have the water,
million
they have everything
equivalents
set up. Many, many
per kilogram.
places are moving away.
patient weighs 154 pounds,
Moving to packaged
and on hand,
Yeah. Ever seen them?
They have inside.
you have 100
They warm them, they have like.
milliequivalents per
It's got
20 mLs.
9 wipes and you kind of.
How many mLs are you gonna give this patient?
I know.
It's not a bath. I don't know what a web says, okay? You would need like 500 of them to get somebody clean. So if you can find a bucket, you know.
1
get
meat
some
per
water,
kilogram.
obviously,
So yeah,
that's
1
the way
kilogram.
to do it. That's for like refreshing if you're camping in the woods, the hills somewhere, and you have no facilities around, but it's not really for bathing. Why do we do it? I don't know. It costs more money, so I don't know why they're buying them, but that's just my little pet peeve. What about making a bed? Okay, any questions about making a bed? Now they have the fitted sheets in most places, so that's awesome. It makes our job so much easier. There are some instances where maybe the linen company didn't send enough fitted sheets, but they have a big pile of flat sheets. So sometimes we have to make a bed with the flat sheets. So there, did they show you, is that, okay, good. So at least you're able to, know that in a pinch, nurses, if we don't have the supply that we're used to, we're gonna figure out something else with a different supply, but we're still gonna accomplish the job that we have to do, and we're very, very good at that. So, that's the occupied and the unoccupied bed. How do you guys feel about, doing AM care on your patients? Do you think you're ready for that? Yeah? Okay. Maybe you can, see if your instructor will buddy you up this week perhaps and give you a patient that you could wash. What about also shower rooms and the shower facilities? Have you seen them in your place? Because some patients are on a shower schedule, they'll get bathed and freshened, but they get showers like twice a week or so, depending on their skin condition. And they wheel them in and they have special, like rolling chairs that they can sit in. The bottom is cut out so they can make sure that they get them clean. What about diapers and chucks? Have you seen that?
Diapers, yes, but they didn't use chucks. I also was wondering if it would save, not saving sheets, but not making them so soiled, because they're gonna be washed together. That facility didn't use chucks.
No chucks?
No, but diapers, yes.
Diapers, yes, and some facilities
So please,
opposite.
I'll be the last
Chucks,
person to
yes.
tell you about handwriting. Let me see how I write.
The problem with
Okay,
the
so
adult
sit.
diapers is
So,
that they're not
sorry.
changed
No, no worries.
consistently. It
So
can go
you can get rid of
over
this and this, right?
And urine,
You got
if
this here.
sit in urine,
Good, so
think of a baby in
how
a
I would do
diaper
it to make it
rash
make more
is
sense to me
very,
is put
very
1 kilogram to 2.2 pounds here. So I know I can get rid of it that way, and then put my 154 pounds on the next
I
line.
would say if your patient had an adult diaper on, you should check it very frequently, check the skin frequently. Because every time you soil it, what would you do with the baby? The same thing, right? You're constantly checking the baby's diaper if it needs to be changed for the same reason. The urine burns, and then you have broken skin, and then you have urine in that, and you burn. Yeah. All right, but cleanliness, hygiene is very, very important. You will see when you go into the hospital setting, I have seen a very disturbing trend these past couple of years, that nurses are not interested in very much just want to see them do it, or does it get done? And I have asked and then there are facilities where they make it a part of your routine. So depending on the census of the floor, or even in your facilities, who gets washed in the night, who gets washed in the day. Usually they try and divide the division of labor so that it's fair for all of the shifts, and you'll see that when you move into a hospital as well. So a lot of the culture and the behavior is going to be driven by you. And what you do as nurses when you are in the facility. So please make sure that really listen. You don't convert to get up and go to the center, whatever that's it.
All righty.
Let them do their thing.
Do we have fun with that one?
If they're able to take a shower, they're
All right.
ambulatory.
So we need to know how many
they
of
can walk.
So go back to the doctor's order, what we need.
That they
is
can
per
have
kilogram.
a shower.
All right. So
Activity.
how do you wanna go with
And
this?
we let them go in.
What do you want to put next? Couple things you can put. Okay, you want 20 mLs in 100 meeks?
So, do that.
Okay, I got rid of, oh, no, I want you.
Sometimes it's the
Got rid of
little
my
things
meats, that's
like
good.
this
I
that
have my
really
mLs, which I need.
memorable
What
stays
else?
and make
We
One
have rid of the kilograms, you want 54 pounds, okay.
you thought of the little things.
Still got kilograms and I got pounds. so what do I do?
1 kilogram, 2.2
What's
pounds.
going on in the room?
Done. Just have my mLs left.
That's a great thing.
Do all that math and it comes out
Yes.
to 14.
Yep.
Now,
They should be able to do
Please,
counting by
please
itself.
do not convert this number
Provider is
outside of the equation and put the number in. I'm telling you, it's gonna come out spicy.
Usually, if you see the shower rooms and facilities,
Questions on that?
yeah, they have that like a little reddish thing or something. So we are not going to.
No, yes, you are, my God. Who would not want to have fun?
Accidents happen.
Yes, especially when this is my present to you.
But again, there's each of the buildings.
Sometimes,
I
you have to figure out.
even a little bit on the fence as to whether or not they
Total
should do
dosage
it.
that the doctor orders for the patient, is it within a safe range that is recommended by the manufacturer of the medication?
And
So, for example,
even if they.
a medication on the manufacturer's package
Yes, I time when
says
that person will get a bath.
the safe
So,
dose for
at
this
some point in
patient
time,
is 50
we have
to 75
special chairs,
milligrams per
special
kilogram.
things.
That's a
We need to
range,
take
right?
that person out, even
You gotta
in a
figure out,
higher,
the meaning,
and it's
the
gonna
minimum
be
they can
under
have is
that,
the 50
and you're gonna
milligrams per
set up
kilogram
because the chair
for it to
can
be
go back,
effective.
it can go
The
anywhere you want.
maximum they can have
however
is
make them
75
comfortable.
milligrams per
And that
kilogram
person's
in
gonna
order
get
for
a
that
bath,
to
and
be
you're gonna
toxic.
take them back up with
We
them,
gotta
or
make
you put them
sure
back
what
in
the
their
doctor
bed,
wrote
take
falls
them,
within that range.
dry them,
Now, on your
take them,
exam,
put them back in their chair.
you're gonna have 3 choices,
No matter,
A, B, and C. Now, I don't know if this is the order that it's gonna be.
maybe not
so
be
don't,
every
like,
day or often.
convert this,
Right.
commit this to memory.
Even
A might be
they can do the
administer
shower.
the med.
So,
B might say hold, med too high, dosage too high.
And again,
C
depends on
might
the
be
facility,
hold,
the
dosage
schedule
too
that they
low.
have, the types of
Because you don't wanna give it too low. We all know you don't give medication that's too high, right? We all know that. But also, you don't wanna give it if it's not gonna work, if it's so low that it's not even gonna do what it's supposed to be doing. So you wanna make sure it's at the minimum range, but not over the maximum range. So, what we're gonna do once again. Sure.
accompany them. Usually in a facility, it depends. If the shower room is down the hall, yeah, you can walk with them.
You mean fill-ins? Yes, so there, most of the fill-ins, these safe dose range ones I will do will be multiple choice. So if there's 1, 2, 3, I don't know how many are on there.
That's
You know,
your
I
activity.
can tell you how many are on there. I
Don't do
have
it without an activity.
But, it'll be multiple choice. So
Any
you
other
can
questions
choose
about
any
what
of
you
it.
saw?
But everything else we
Saw?
fill in the blanks.
That answer your question?
How many times for the patient?
All right, so let's do this one
How
together.
many times what?
The cleaning.
All right, the doctor orders 725
24 hours.
micrograms.
Like once a day or?
Depends on
The
the
patient's always.
PID.
always
You
again.
have to go. Which one today?
Yeah. Yeah, if they're
Right.
incontinent,
So
you may
patient
be
weighs
cleaning them
210
very
pounds.
frequently. If they're not incontinent, then it
The
could be
same
once a
dose
day.
rate.
Like, how many times do you take a shower? On a hot day, if you're sweaty, if you're working outside, you're probably gonna do it more than once, right? But
Micrograms
if everything is okay and it's a
per day.
routine day,
Let's just say.
yeah, you might,
dose.
yeah.
Now,
Depends on
my
the
next question
situation.
to you is what should you
There's
do?
nothing written in
Well,
stone,
this is
remember,
a
as a
three-step
nurse,
process,
you
okay?
have a lot of leeway in
4 to
using
8,
your
yes, that's a
nursing
4.
judgment.
Okay. Now,
Just
this
because
is
a
a
patient
three-step
hasn't
process.
ordered,
First
you know,
first
made
step,
once
number
a day,
one,
if they
you
need it
have
more
to
than
figure
once
out
a day,
how
are they gonna
much
do it more than once
this
a day?
doctor ordered for this
Do you need
person
to order
for
for
the
that?
entire day. Because this 4 to 8 milligrams per kilogram is for the entire day. That's how much the entire day the patient has. So first step is, how much does this patient,
Because
the
what
doctor
happens
order
if
for this
somebody's
patient per day?
skin breaks?
So what you do is you take the 725
Own it.
micrograms, and what am I gonna times it by?
So sometimes
Two,
it might
right?
be,
Because the doctor ordered it to be twice a day.
might be kind
So
of like
2 a day. That comes out to
progression of things,
1,450
that
micrograms.
maybe they had a skin
This
breakdown or
is
pressure injury
what
or
the
been
doctor
sore
wants
with
this
acute
patient
eye,
to have.
but
per
we
day.
don't know, okay? If
Okay?
especially
Now,
if the
your
patient
job
came
is
into
to make
us
sure
with
that's safe.
intact skin,
That it's not going too
And
low, to
develops
not
it.
do anything, or it's
It's
not
on
going
us.
too high.
that's
to
why
possibly
when a
potentially
patient
harm you.
first comes into a facility,
So
we have
step
to
2
do
then
a little skin
Is you're gonna take a look at the minimum
The patient
amount
comes
patient,
in with a
the
skin
amount of
injury
patient they have.
or a break,
Does this fall
or
within
a
at least
skin
the
tear,
minimum?
or a bruise,
So, you're
whatever
gonna
the
do
case
4
may be.
micrograms
We generally will take pictures of it, okay, as
per kilogram,
documentation.
okay? Now,
On our
patient weighs
facility.
210 pounds, so I have to do, I'll do my 1 kilogram,
That
It's 2.2
documentation
pounds.
is key.
right, so I get rid of my
Keep the
kilograms.
patient, keep
How am I gonna get rid of my
us,
pounds?
keep preventable lawsuit,
Put my
for sure.
210 in there.
Like I said,
Pounds, pounds. 4 times 210 divided by 2.2 comes out to be
Your
381.8.
degree works. Did everybody finish giving me their degree works?
So it is, it's 8, if you're doing the math, it comes to
If you didn't,
840
I will hunt you
divided
down.
by 2.2.
If you say yes,
That
you
comes
did,
out to
and I don't have
38.
it,
This
and
is
you
the
did
low
not.
dose, this is the lowest amount, 38.1 micrograms of this patient has, in order for it to be effective, okay? Step 3, now, I have to figure out the high dose. It's exactly the same way, except you just instead of 4, you
All right, guys, stay tuned. I will be sending out an email later on in the week. Monday, we're supposed to be getting that test-taking strategy with ATI.
That comes out to.
So we need to find out, I need to find
700,
out
where
where
the
they
math,
put
that's
us.
730.
May not be our class.
So this is the minimum the patient could have, right, in order for the medication to be effective. This is the most, the highest. Now what you do is you take the number that you said here, this is what the doctor ordered. Does this number fall anywhere between these two? No. It's way too high, right? 736 is the maximum the patient could have. Doctor ordered 1450. That's double, right? So you would have to hold the medication is too high. Me? Yeah. What you would do, notify the doctor that that was too high. So that's it. In the hospital, there's 3 security checks for medication administration. I know you have 6 and you have the rights and all that stuff. What I'm talking about is the doctor puts in the order. That's the first check. It's supposed to be that pharmacist. Then the second is the pharmacy. Should have stopped this order. Next step, the final step, the last step before is you, the nurse, before it goes to the patient.
This is for every medication that you give to the patient.
That has a range.
Only
that
has
has
a
a range.
range.
Yes,
Okay.
exactly. Only that has a range. Yes.
I've got 760
63 plan.
Oh, did I make it? You're right, sorry. I wrote it backwards, sorry. Okay, so, you got that now?
Question.
Yeah.
So why did you say he can take it?
You can't, because this is the minimum in order for it to be effective, 381 milligrams a day. The maximum this patient can have is 763 milligrams per day. The doctor ordered almost twice that amount for the patient to have, 1450. That's almost double that number. But let's say, let's shake it up a little bit. Let's say this is 725 QD. QD is how many times a day?
4.
Once, right? So then 725 times 1 is 725 micrograms. Then what are you gonna do? Then you gotta give it. Because this 725 falls between these two. It's not lower than 381, but it's not higher than 763. Falls right in between. That's what we need it to be when it has a safe range. So no, okay, let's do it again. Let's do it back the
No,
way.
this 725 is middle of these two numbers?
Right.
Yes.
Right,
Let's
it's
say-
not lower than 381, but it's not higher than 763. It's 725, so that's good, it's in the safe range too. But the original one said 1450, because it was twice a day. Alrighty? We're gonna do more, because I know this is a little, yes,
So on the test, like the option you picked is you can't take if the dose is too high.
for the original, this one would say you can administer as ordered.
Yeah.
The first one I did before I flipped it would say yes, hold, it's too high. That's the one you would choose. Alright, let's do another one. Alright, a doctor orders 30 milligrams, Q8 hours, for a patient who weighs 52 pounds. The safe dose range is 2 to 4 milligrams per kilogram per day. Is this dose safe?
Tell me.
How many centimeters is that?
3 times. And I calculated here. Oh, thank you. You already see how many students this morning did the same thing?
Right? No, I did to make sure that I knew from divided by.
Yeah.
And I did.
Yeah, there you go.
Yep, very good. Okay, I got a different number than this here, so let's see, we got 4. I think you just might have did your math wrong here. I don't even have the right sheet on me. Oh, yes, I do. This comes out to 104.
Oh,
Just do
this
your
is
math
the
over
first
again.
step.
If that one's right, just do this math again.
Okay.
Yep, correct.
Oh, okay.
See, that's a big difference. That could change your answer.
They're gonna need it.
It's 52 pounds, LBS, pounds. That's not a decimal, it's not 5 pounds. I'll look at you, right, how are we doing? You giving it? Yep, so are you gonna give it? Yes. Good, excellent. How about you, you gonna give it? Yep, good.
Yes, right?
Yes, yep, you're gonna give it, right, because you came up with 90 milligrams, and that falls within that range, right, exactly. Yep, yep, exactly.
Okay, you got this the match. Oh, no, I mean, this is the square, right? So this is a low. This is a max.
Yeah, that's right.
We should all go. Did she say it's a
Yeah, so it's good, right? Because it's still, it's not too low,
It's not over the max.
not below this, it's not below that. So you're still gonna get it.
You can't go.
This is 90, and it's not more than this, it's not less than this, so you can give it down. No, this is more than that.
I got you.
Good job.
This is the max. You can't get over.
I don't understand the the safe rate. I don't understand. Can you just average it and then figure out? There was a question for you. There was a question that said, when you look at the
All right, so we're getting there. You guys are using those brain cell reserves. Good job. All right, so first step is to figure out how much the doctor ordered for a day. So 30 milligrams, Q8 is times 3, right, equals 90. Step 2, the low dose range, 2 milligrams per kilogram. I know that 1 kilogram is 2.2 pounds, and the person weighs 52, I'm assuming a child, hopefully it's a child, 52 pounds. So we do that math, what do we come up to? 47.27?
Yes.
Next thing, technically, what you really can do, if it's, because this 4 is just double this, right? So if you wanted to be like really creative, you could just times it by 2, right? And then you would come up with a 94.5. But what I like to do is just be safe and do my own math this way. 4 milligrams per kilogram, because what looks very normal to me in classroom and then versus what I do in the test, sometimes are 2 totally different things, right? So I want to make sure I do it right. So 1 kilogram is 2.2 pounds. Patient weighs 52 pounds. And that comes up to, I think, 94.5. Now you're taking this and you're saying, okay, doctor ordered for this patient to have 30 milligrams a day. 90 milligrams a day. Does this 90, is it more than this, but less than this?
Yes.
It is. So this medication would be safe to give. What if the doctor ordered it Q6 hours? So that would be, Q6 hours is 30 times what? 4, right? So that would be 120 milligrams. Then would it be safe?
No.
Too low. Too high, sorry, too high. What if he ordered it 30 milligrams QD? So it's 30 milligrams times what? 1, which is 30. Then you'd hold it because it was too low, because it's below this number. You with me? All right. Last one. And then you can go home. Pull it out. Come on, people. You can do it. That answers the question. All right. Sometimes there's not a range. Sometimes there's just a maximum dose. All right. Sometimes it's not a range. It's a maximum dose. This is the maximum the patient can have per day. So it has to fall below that number. All righty. It cannot go above that number. So sometimes it's not a range, it's just this is how much. Like, probably learned about acetaminophen. How much can a patient have of acetaminophen so far?
All right, nothing? Per day, look it up, you'll learn.
24 hours, I think it says 400,
4,000.
4,000.
Yeah, right, exactly. So some doses have maximum amount that you could have per day. If you have more than that, it could damage part of your body, your liver, your kidneys, whatever it is that medication, whatever body part that medication could damage, okay? All right, so this doctor is going to order ibuprofen. This is one that could damage your kidneys. Ibuprofen, what is ibuprofen? It's an anti-inflammatory, right? It's a non-steroidal, it's an NSAID we call it, a non-steroidal anti-inflammatory drug. All right, 400 milligrams, Q12 hours. The maximum safe dosage of ibuprofen for a child is 40 milligrams per kilogram per day. The child weighs 55 pounds. Is this dose safe for this child? So notice it's not about the minimum and maximum. It's not a range. This is the maximum the child can have. Can you give that medication to this child?
That's 12 hours?
Q12, yes.
Thank you. I'll see you later.
Also, what are we looking for? If it's safe.
Tell me if it's safe. Is that dosage that the doctor ordered for the patient, is it safe for the patient? So this is the order. And this is the max dose. Okay, so this is the maximum the child can have, the maximum. Is that 4 below? So you think, I hear it saying non-safe. Okay, let's go. This is what you're targeting. That's what the doctor ordered. This is just the maximum dose. Okay, so 400 times 2. So it's 800. No, but it's safe. This is the maximum right? And so 400 times 2 is what? That's what the doctor ordered. Because it doesn't go over maximum.
Yep. So all you need is, you only need 400 more is to figure out the daily dose. It's 400. Oh, I see. So just in that range, this is what the doctor ordered, 400 times 12.
How much you got?
1,000 is the same.
Because if you only have 40 milligrams, then you do your 40 milligrams per kilogram. Step 2. Good, so what are you gonna do?
You're
gonna give it?
Yeah, because the 7 is between.
I didn't hear you, so you're gonna give it?
I think it's safe.
It is safe, right? Because it
Yeah,
doesn't,
because
this doesn't go above that. So yeah, it's safe, very good. Yep.
I got twice, that's what I got. So it's 800 the max.
Okay, so how much is, so the patient's gonna get, doctor orders 8 milligrams, right? 800. Max, 800, sorry. The doctor said 1,000 is the, I mean, not the doctor, it says 1,000 is the max, so it's safe. Yeah, no, you and everybody else did today, me and this is just 21 that I got. So you give it? Good. Yeah, no. Yeah, maybe like first, the steps. For maximum, that this patient is, doctor orders 800, right? Maximum this patient is the maximum. I know that's the you figured that out to be 1,000 milligrams, right? So the doctor orders 800.
And then 1,000 is.
That doesn't go above this.
It's not in the range.
Think about it, do you ever take Advil? Right? Do you take 1,000 milligrams, or can you take, if you just want, if you have a headache, you take two 200-pound tablets with 400 milligrams, right? Yeah, we're giving it 400, but we're giving the doctor ordered 400 milligrams twice a day.
Oh.
So 800 milligrams, you got that, you did that, 800 milligrams, you got it. So this is maximum amount of ibuprofen they have a day.
I would say, like, maybe
This is how much the doctor is gonna have to get. To make sure that they will above the maximum. How we doing over here, everybody? You gonna give it or not give it? Okay, well, let me tell you, it is safe. And I'll tell you why. So you got this right. Doctor ordered the patient 800 milligrams. No, 400 times 12, she's got it, 800 milligrams, right? This is the maximum a patient can have. This is,
It has to be in the range.
No, it has to be in range,
But I
make
didn't
sure.
see where, I didn't see the max.
Max dose. The max dose. I can't read handwriting, which is terrible. The max dose.
Next to the 40 milligrams.
Yeah, this says max dose.
Also, what I thought was when we do the 400 milligrams times whatever they say for how much for the day.
That's your doctor's
And-
order.
Right, the doctor's order tells us that once it's that number, you can't go beyond that number.
You can't go above it, but you can go below it. If they only give you the maximum amount, I'm sure we've all taken ibuprofen here, right? So so how many milligrams is ibuprofen each tablet?
500,
600.
400.
200, well, the prescription strength, that is, 200 on over the counter, right? Over the counter is 200. You take 2 ibuprofens, that's 400 milligrams, your headache goes away, you don't need any more, right? So you took a dosage, but you didn't go over the maximum dosage that the manufacturer prescribes. So this is what, if there's not a range, if it just tells you the maximum dose is this, you just gotta make sure it doesn't go above it. So let's do this one.
I'm kind of lost. Because isn't that 1,000
I'm gonna
more than
find
the
you.
800?
Yes, it is. Yes, it is. I'm gonna find you. All right. So 400 milligrams. We all got this, right? 400 milligrams times 2 is 800 milligrams.
Right.
That's what the doctor ordered for the patient. Okay. Now, step 2, I don't need a step 3 because it only gave me the maximum. They didn't give me a minimum, just gave me a maximum. So 40 milligrams per kilogram, okay? And then I know a 1 kilogram, 2.2 pounds. Get rid of that, put in my 55 pounds. Get rid of that, get rid of that. What's my answer? This comes up to 1,000, right?
Yeah.
We all got that. So I think we all made it to this step.
Right.
The confusion is now, why if he ordered 800 or she, and 1,000 is the max, why is that okay? Because this is the maximum amount the patient can have per day. You figured that out. This is the max dose per day that this patient can have, is 1,000 milligrams. Cannot go over that.
But he's only
How do
having
we know? That's
800.
what I'm saying, like,
No,
how-
he's only
how-
having
where do you know?
800. He's only having 800, and the maximum we can give is 1,000. So
Yeah,
that's
but
safe.
how would we know that the 1,000 is gonna be in the safe zone? Because it's more than.
It's not
800.
safe zone. This is not the number you're checking.
It's
This,
the
you're checking the
maximum
doctor's
dose.
order. You're checking the maximum dose. The number you're looking
Oh,
at
we're
the
just
doctor's
checking for a
order.
maximum dose.
Right, right, in this one, this one. The other ones we did before had a
Then
minimum
ask for
and a
safe-
maximum.
Safe, okay.
Yes,
I get it,
yes,
I get
this
it.
is the maximum the patient
I get it
can,
now.
no more than this.
Like this one.
This is the max.
Right.
Alright.
So, would you question the doctor's order?
No.
How come the doctor gives you something that's not safe?
No, it is safe.
No, I'm not talking about this one.
Oh, like the ones we did before? Yes. So wait, there's an important question, everybody. Everybody, important question in your nursing world. This is gonna come into play. So let's say our first one that we did like this. It came out to 1,450, remember?
Right.
And it was almost twice the amount the patient should have. What should you as a nurse do? Number 1, don't give it. Number 2, call the provider. Whoever wrote it, you need to say, you ordered this medication, this is twice the amount.
Do you want to kill the patient?
Right, so do you want to change this order? As a brand new nurse, my suggestion to you is grab a nurse that's been around a little bit longer and say, this is the math I'm coming up with. Are you coming up with this too? Just so you double check. You don't want to call a doctor and be like, oops, sorry, got the math wrong, oops. Alrighty, so just, you know, as you get a little bit more seasoned and more experienced, you'll just know it. But when you're first starting out, say, uh-oh, I ain't giving this, alrighty? Get another nurse over, say, can you double check my math? And if they agree with you, you call the doctor.
So so we'll know the difference when we see examples of what the doctor's giving, the safe range, that's when you know the difference. Because this is just asking us for
Maximum dose.
maximum dose.
Yes,
Okay.
yes.
Alright,
When you see 2 numbers, if I said 4 to 8, or if I said, 2 to
that's when we
4,
know if it's a safe.
then you know
zone.
it's a safe range.
All right.
Then you have to do a 3-step process. This only gave you, this is
Maximum
maximum, so
dose.
it's just 2 steps.
Okay,
We good? Define good, Belomo. Alrighty, I have sucked enough brain cells from you guys today.
He was gonna give us examples.
The lab, your lab manual, today you're supposed to be doing lab number 3. In your lab manual, do that. Not today. This is what I want you to do today. Nothing. Alrighty? Don't do any schoolwork today. You need a mental break. Tomorrow, you can do this lab. And the answers are on Blackboard. I'll take a look. Oh, everybody, so we're on the same page. Comprehension assignment number 6 would help you with what we did today. So if you want to do number 6, it's on Blackboard. Your answers for lab 3 that you're gonna do tomorrow are on Blackboard. We'll go over that tomorrow. Okay? What's that? Ah, you're here.
We're not gonna see submit it or not?
No, I know. I'm saying you do the lab tomorrow on your own. On your own. Compare the answers on Blackboard.
Do you want it submitted or no?
No.
No, I got enough work to do.
Yeah, you don't want to do it. Go to your bed.